Welcome, everyone. We're so glad you're here. We'll give folks just a few minutes to roll in. We're so glad you made time on Friday afternoon, maybe Friday morning if you're on the West Coast, to join us to talk about Project ECHO today. My name is Katie Baichy, and I work with Comprehensive Cancer Control Coalitions on behalf of the American Cancer Society. So we are so glad you're here. And Allison, why don't you say hi as we get started?
Sure. I am Allison Rosen. I am director for Project ECHO at the American Cancer Society. So I'm really excited to be here and talk to you about something that I truly love.
Thanks, Allison. Next slide, Rich. So why are we here today? We'll get to in a second, but I just wanted to do the usual housekeeping for you all. We are going to record the session. So I got lots of messages from folks saying, I'm off Friday. Can I listen to this later? So we will take care of that for you. If you wouldn't mind, while we're getting started, put your name in the chat box. We would love to know that you're here and have a way to follow up with you. We did not do registration for the webinar just to make it super easy and one-click join. So if you wouldn't mind putting your contact info in the chat, that would be great. And then as the webinar goes along, if you have a question, since we're in a webinar format in Zoom, you can click on the Q&A and put your question there. So if you look at the bottom of your screen, you'll be able to see Q&A and chat and all that fun stuff. And if you have any questions, just put them in the chat and we'll try to help you. So put your name, email address, and org in the chat box if you wouldn't mind. That would be great. So next slide. What are we going to do today, folks? Well, many of you might be on this call because you are a Comprehensive Cancer Control Coalition member or staff person, and recently found out that there's an opportunity for you to consider conducting a Project ECHO. We know not everybody on this call has chosen that option for their Cancer Coalition, but we thought it would be super timely just to do a Project ECHO 101 and offer it widely across the country for coalitions who might want to consider it either now or in the future. So what we're going to hopefully cover for you today is kind of the basics, almost a primer, if you will, on Project ECHO. We'll look at the core components of ECHO. We will talk about what makes it different from a webinar series. That was one of my big questions early on. And then talk about how you might consider using it and what you might need to think through as a coalition as you consider conducting one, again, either now or in the future. And we hope we'll get some good questions for you to ask our panelists a little bit later and ask us down the road. Next slide. I'm going to hand it over to Allison because really at the American Cancer Society, Allison is the guru of Project ECHO. And we go to her with all of our questions, and she heads up many of the ECHOs for our enterprise. So I've asked her to join today to give us the nitty gritty. So take it away, Allison.
Thank you so much. And as I'm talking and sort of giving you an overview of what Project ECHO is, some of you might know a lot, some of you might know a little, and feel free to add any questions you have as we're going if terminology isn't making sense or whatnot, because we're going to try to make sure we have a lot of time at the end to answer any questions you might have. So next slide, please. Okay, what is ECHO? What does ECHO stand for? That's the biggest thing I get asked besides all the logistics. ECHO stands for Extension for Community Healthcare Outcomes, and it originated in was founded in 2003 at the University of New Mexico Health Science Center, and Dr. Sanjeev Arora founded it, and really it was developed as an innovative healthcare movement, and the mission of it was to develop the capacity to leverage knowledge and amplify the capacity to provide best practice care for underserved people all over the world. So really it's a way for people to spread knowledge, and essentially it is all virtual. So it allows people from all over the world to join and share best practices. So Zoom is a platform that we use through that, and it's a hub and spoke knowledge sharing network. And we're going to go a little bit more in the next slide about what hub and spoke means, because I didn't know when I first started doing ECHO years ago, but at the American Cancer Society, we use ECHO to effectively or efficiently disseminate evidence-based strategies. And the whole goal is to improve cancer outcomes, increase prevention, early detection, help with implementation of quality care. And the whole goal, again, is really for American Cancer Society in the cancer field is to increase the quality of care and ensure all people who have cancer and survivors have access to the recommended treatment. Okay, next slide, please. So this image in the center gives you a better understanding of what hub and spoke is, what ECHO is as a model. So if you look at the top in the image, you see the red symbol. That represents the hub. The hub is the site of expert knowledge. And a hub would include a facilitator, expert faculty that you recruit to be part of your ECHO, and is considered your host, the person that you lean on for everything. So the red is the hub, and they help share best practices, help lead in the sharing of best practices through case-based and didactic learning. And we'll go a little bit more into what case-based and didactic learning looks like and what a typical ECHO session layout looks like. So you have the red, then you have all these yellow circles that are the spokes. So there's spoke participants, spoke sites, and the spokes are the learners. So they're the people from your coalition, and they could be, for example, from your coalition, they could be all your partners, health centers, universities, health departments, nonprofits, survivors, cancer centers. They're anybody that is within your network that's joining an ECHO session to learn. And the ECHO model, why I love it so much and why I think it's amazing, is because it's a network that allows experts accessible to all. So you might not have another opportunity to have a series of sessions where you can interact with a worldwide expert on a specific topic that you're educating people about. So that sort of is how the model works. And it creates this lovely learning loop. So you all learn from each other, all teach, all learn. The experts too that are part of the hub learn from you all and what you're doing within your, again, system, university, health center, coalition, health department. Okay, next slide. So there's 4 pillars that make ECHO unique. And I'm going to give you a little bit of information about each one. And then the one that for me is at the center of it all is the case-based learning. So really case-based learning is where you can present an actual case. It doesn't have to be patient specific. It could be something that's going on within your system, your coalition, your nonprofit, whatever, wherever you're coming from. It's what's going on and what you want to present to the larger group that you can get feedback from. Someone can say, this is a success for colorectal cancer screening that's working. This is not working. How can I make this work better? So people will share their best practices. People will share documents, people will share resources so they can help you with whatever challenge you're having on a specific topic. Then amplification. Amplification is what I said earlier, basically using the technology to leverage scarce resources. So everyone should hopefully have not access to Zoom or technology, especially with COVID. Zoom's used a lot more nowadays, and people understand it a lot better. But as part of the ECHO model, Zoom is provided for all to have access to. And then I talked about sharing best practices. The whole idea is to reduce disparities and have people from all over, rural, urban, north, south, east, west, other countries join so that everyone has access to sharing what they're doing so they can learn from each other. And lastly, ECHO uses a web-based database to monitor outcomes. So we track all the data essentially just so we can, better understand quality improvement and outcomes from our sessions. Next slide. So what makes ECHO different? And I mentioned this a little bit earlier, but I think I'm going to hand this over to Katie so she can talk a little bit more now.
Yeah, and feel free to chime in, Allison. But I know comprehensive cancer coalitions have a big task on their plate, that they are expected to make population health level changes, right? Which with scarce resources is difficult. I myself was a cancer coalition director for 15 years. I know how challenging that can be. And one of the things that I like about the ECHO model is that learning loop that we have on the slide right now. So, and again, I'm gonna explain how I feel it's a little bit different than doing some sort of webinar series or even a learning collaborative. In this whole concept of one-to-many, that you have access, ongoing access to the same experts. So that's at the top of this diagram, the specialist team. So you identify faculty that will be with you throughout your series and constantly be able to be giving feedback to your learners. Your learners could be patient navigators, other public health professionals, providers, whoever you're trying to educate. And they have constant access to that faculty in an ongoing way. And then they have the ability to share what they learned with community members. Because they've been in this mentorship throughout an ECHO series, it seems to sink deep, the knowledge sinks deep from the evaluations that we're privy to. And it's just an effective way to go deep over a structured period of time with the same people to build community. So I think that with our scarce resources, Project ECHO has been a great option for us. Do you have anything to add to that concept, Allison?
No, I mean, I think it's the learning loop so that not everyone from a system or institution has to join. The idea is for whoever might be able to join, because everyone's really busy, to take that knowledge and then bring it back. And then that will then disseminate to the communities that you all serve, essentially.
Yes, thanks. Next slide. So we put sort of a side by side here to let you know what we think are some of the distinguishing factors. And again, I mentioned that consistent group of subject matter experts. It's like having your own mentoring team with you throughout a series. And that, I think, helps you to form future networking, to reach out to them with questions, ongoing relationships. And really the biggest difference, and Allison said this, but it bears repeating, are the case presentations. So when I hear the word case presentation, we'll talk about this in a minute, you think medical or clinical. But I've learned over the past couple of years here at ACS that a case is anything. It doesn't need to be clinical. So for example, as a coalition, maybe you do an ECHO series on how to increase your coalition's capacity, and you have a topic for each ECHO session. And maybe someone brings a case like, well, here's the situation. We keep getting the same core people to come, but they're a small group. We can't seem to engage a lot of people at one time. That's your case. And then the faculty will ask questions. What have you done in the past? What do you plan to do? And your peers will also weigh in maybe on ideas that they've had. So it's a structured way to present challenges that you might have. And it doesn't need to be clinical. It certainly can be, and that's how it started. But as you'll get to know more about Project ECHO, it's expanded far, far beyond that. I also think that one of the exciting parts of it is the peer support. I've mentioned on another call this week how much I love talking to other people who run coalitions, because you speak your own language, right? Everyone has their own lingo within their professional sphere of colleagues. And so I think it's a real opportunity for coalitions to work together and do ECHOs. Allison, anything to add between this comparison that stands out to you?
No, I mean, I think when you have an ECHO, you have most of the time you might have your picture on, your sound on, so you can unmute, ask a question. A webinar like is this, we're speaking and you'll have a chance to interact and ask questions, but really you get to see people, you get to create these relationships so that it is developed even beyond the ECHO, so that you have people that you can reach out to that you might not have had otherwise.
Yeah, good point. Thanks for that. I'm going to lob it back over to you. Next slide, Rich. Allison's going to just break down for you like the different pieces of an ECHO, how long they take, what they're made up of, so you have an idea of what you might be getting into if you decide to take one on. So go ahead.
Awesome. Next slide, please. So what is a hub? And I know I mentioned hub and spoke model, and I know most of you on this call are not hubs, but we really do think it's important that you know what the role of a hub is, not only so you can work more effectively to support them, but in your case, if you decide to pursue hub status in the future, because how ECHO is, there's super hubs, there's hubs, and then there's, again, participants or spoke sites or spoke, again, spoke participants. So here is sort of like what a hub team consists of. You have a facilitator lead that, facilitators come in any sort of online collaborative or series or even webinar. The facilitator is a normal role to have. You have a program coordinator, and that person is your point person. That person is who you go to, who helps organize, making sure we have the case presentations, the didactic speakers are all together. You need that person that you can 100% count on to make sure everything is organized and ready to go for one of your sessions or all your sessions. IT support staff, you always need that, especially with technology. You never know if you get on and you don't have sound, you can't hear, your camera won't go on. So you have, a hub is a team. We all have to work together. Not one person can do everything. And of these people that I'm talking about, some people serve multiple roles. Subject matter expert. The subject matter experts are your faculty or ad hoc faculty. And faculty are people that are at every single session. They're your experts. You might have one topic you want one specific person to come and talk to the group about. So that's where your subject matter experts come in. They're the people that help lead. Here's what we're talking about. Here's the topic we're talking about. They talk from experience, and then, all the participants and stuff can get feedback from them and everyone else that's on the session. And the case presenter, that would be the spoke site role. You're there to help not only present a case, but participate in other cases that are presented by other spokes participants, because we want everyone to learn from each other. And what I've learned about doing ECHO over the years is you really think you know a lot, but then you get on these ECHO sessions, and over time I learn every single session something different. And one thing that isn't listed on here, because it's not like a hub role, but you do have an evaluation as a part of ECHO. It can be something little, something big. There can be a pre knowledge test or a survey. There can be a post ECHO survey. There can be qualitative, quantitative. It's sort of whatever you want, and it depends on the topic. We said that most of the case presentations, they can be clinic-based, so you might have patient outcomes, or they can be knowledge-based, which a lot of them are knowledge. So did anything come from ECHO? Did anything happen as a result of this ECHO series? Did a roundtable be created? Did you increase your screening rate? As ECHO can be an implementation strategy to help increase your screening rate. So that gives you a little bit better understanding of who all is consistent in the as a part of the hub. It's a bunch of people that help make ECHO successful from beginning to end. Next slide. Again, we know most of you are not currently a hub, but it's helpful to know what goes in. So I said all this as far as who's in the hub, but we really want you to better understand how you can potentially support a hub, just with everything that has to be done. And some of this might not be, you might not understand everything that we're reviewing, but again, we're happy to answer questions after, but you have essentially a lot of the time is spent pre-launch. So before the ECHO actually starts, you got to do a lot of different things. If you're wanting to be a hub, you attend ECHO immersion. Some of you within your coalitions might have a partner that is a hub already, so that might not be something that has to be done. Really, you want to have a lot of time spent with curriculum design, and I think faculty recruitment. So you want these expert speakers that will bring the participants in, that will be like, ooh, I want to hear this person speak. They're amazing. And I want to hear them and I want to create a relationship with them. And I want to, be a part of something where we can all learn from each other. So faculty recruitment, participant recruitment, so it's spoke sites and spoke participants within those sites. And then, as in any online collaborative or webinar or anything where you're interacting with each other, especially when you're presenting cases, there's going to be waivers and contracts and a lot of that, you have to go through legal for that. So we spend at ACS quite a bit of time talking to our legal department, making sure everything is in line and everyone knows what they're doing and whatnot. And then you have next part, mid-series. So with this, once a session is going on, it's mainly on, I want to say, the coordinator, but you have other people that help within the hub, compiling, reviewing PowerPoint presentations, making sure everything's on. You have the PowerPoint didactic session, you have the case presentation. It all runs smoothly, because as you'll learn, and I'll talk, I think, on the next slide, each session is about an hour. So you want to make sure you have enough time for people to, present their case and ask, and be interactive and ask questions and provide answers. So as much as you can do to prepare for that actual session, and it takes time to put all that stuff together. I echo data entry. So when I mentioned data entry as one of the core pillars, or compiling all that, there is a system through UNM that you enter all the attendance, who attended, what institution they're from, what sessions they attended. So it's great. Everything's in one central online website that you can go back and look at. Do these people attend 5 sessions, 7 sessions? How many participants attended? Who presented the didactic? So it's really nice to have all this information in one, but it takes time to enter that data into the system. I know that very well. And then resource development. So the other part of ECHO, which is great, is people provide resources while you're in the session, and you have resources that you might want to provide afterwards. So not only is the didactic and case presentation PowerPoint sort of shared and the recording shared, you have as a part of ECHO to share back to the participants all the resources that might be presented. So you're not like scrambling to make sure you click on every link, every website. We create that and we think that's really powerful. And then lastly, we have the post series. So that's where data management and evaluation comes in. And again, you can do evaluation as little or as much as you want, depending on the specific topic. And we know what the topic is for this ECHO that you might be tasked with taking on. So evaluation, depending on what you want, again, qualitative, quantitative, knowledge, the evaluation results and create some sort of report at the end, so you can see what you got out of that ECHO, what everyone got out of that ECHO, and that sort of like gives you a little bit of understanding of pre, mid, post. Like I said, I want to stress this: a lot of it happens pre-launch. So as organized as you can be before you actually launch the series will make your ECHO as successful as it possibly can. You don't want to plan each session by session, especially if you're doing something like offering CMEs or CNEs, you can't. So really the bulk of it is trying to make sure you have the best ECHO possible, and then you launch, and then everything sort of falls into place and you create that sense of community. Next slide. So here is what a typical ECHO is. And this is very, this is not, you have to do 10 minutes and 15 minutes and 20 minutes. This just sort of gives you an understanding of what a typical ECHO session looks like. You do housekeeping introductions. I always like with my ECHO, usually put hold music on before people get on and start like a little dance party, make people, wake up and get excited about the topic that's going to be discussed. Sometimes there can be a lovely icebreaker. It's sort of, you can make an ECHO your own in that way. You're all getting to know each other. So by the end, you want to make sure that everyone's dancing along with you. And it's funny because I always got made fun of. I asked one of my icebreakers the first time, what is your best dance move? And by the end, we were all doing our last dance move in our at our last session. So then after that, everyone's ready to go. You get your faculty, they deliver the didactic. So they're your subject matter expert. This can be 10, 12, 15 minutes. So they're given this didactic session, and then you have a facilitated Q&A where you can ask them any questions you might want to. They can ask any questions of the group if they have any questions. Next, you have, again, I think the star of ECHO, what makes it so unique. You have this case presentation, and this is where you, or not you, whoever the participants and the spoke sites, they get to deliver that case presentation. They get to ask, this is what's going on. Can you help me and give me feedback? And I will say this again, you want people, spoke sites from all over your state. You can have parts of, in your coalition, rural areas, urban areas. Like, you want to have a mix of different people, because people have different solutions for different things. You have no idea what you might learn from someone, in the mountains or, by the water. Like, I think what makes that case presentation so powerful is that you present what you're challenging, what's challenging you, what's going on. And then a bunch of people get to chime in, and you learn so much from it. And you have a Q&A along with that. You present the case, you have that Q&A, and then you wrap up. You usually do a post-session survey, and then, usually a week or so after, all the resources and PowerPoint and recording are available. So again, like we mentioned earlier, 1 person, 2 people, however many you want from your spoke sites can attend, but then usually the ECHO model calls for recordings are available for anyone that might not be able to attend, that might want to watch, that wasn't able to be there. So next slide. Again, we can skip over this, but really this is what I say: case presentation, formal communication between healthcare and public health professionals regarding any sort of issue. It can be clinical, it doesn't have to be clinical, it can be practice change related, implementation related, and really anything that would benefit yourself and your institution or organization or nonprofit to get feedback from the larger group. Next slide. Lastly, I get this question quite often, and there's not a set answer. What does it cost to run an ECHO?
We already got that question in chat, so you're jumping the gun. So go ahead and let us know.
This is great because really, at one point I tried to create like a document that said it costs A, B, C, D. Really, an ECHO depends on how much staffing you have, how many spoke sites you have, how many subject matter experts, what type of evaluation you want to do, if you're going to offer CMEs, and any and all of this can vary. And I know that Katie's going to go into some of this in a second, but really, the big cost, the only cost that for sure you have to take into account are personnel. So the time it takes to staff to create the curriculum, recruit faculty, the contracting, because it is very time consuming. It does take a lot of time. So that's where you have to really, the staff time is like number one. That's going to be the one thing that you have to account for. Make sure that person has the capacity and the time to help organize the ECHO. And then, again, we talk about recruitment, curriculum development. Next is IT and video conferencing costs. So Zoom is provided free as a part of the ECHO model, but there might be costs related to if you want to have a conference room or any sort of extra technology that you might want. Some people within one of the spoke sites might not have a camera, and they might want a camera, so you might have to buy them a camera so they can be shown on screen, because really ECHO, you want to see the faces if you can. And then optional speaker fees, so your faculty. Sometimes people offer honorarium, sometimes people don't offer honorarium. It's very dependent on yourself and what sort of budget you have. So you can create your own personalized budget. Sometimes people offer stipend for the spoke sites as a thank you for participating. Again, totally optional. CMEs are sometimes offered as an incentive as well. Totally optional. So really what I want to stress here is you can run ECHO taking out personnel costs with nothing. Essentially, you don't need anything. There might be little bits and pieces here, or you can have an ECHO that's $150,000. Like that's extreme, in my opinion. That's very extreme. But it really is. I think you lean on your hub that's been doing things before, or your super hub that's training your hubs. You lean on them to ask what they've done previously, what they think is best, and then you have your faculty and your coordinator and your hub team that comes together to decide what's best for your specific ECHO, what budget you have to work with, and what you can do with that. Next slide.
Yeah, and I'm building off that, Allison, with this slide. I've asked Allison this so many times, and she's like, Katie, there is no average ECHO, which you just heard. So there really is no true average. For you statisticians out there, there probably is, but what we thought we would share is what it has looked like for the American Cancer Society as a hub for several ECHOs, what it's looked like for us. So the length varies. People say, well, how many sessions is the average ECHO? Allison shared that in her experience, they can be 4, they could be 6, they can be 9. The average for ACS has been around 9, which is probably long, Allison, don't you think? That seems like a, yeah.
Yes and no, it depends. I think in the past year or so, they've been a little bit shorter, but we've had some that are 12, some that are 20. Okay. Like it just very much depends. But recently it's been, yeah.
Which, as you can imagine then, how many sessions you have would affect how much of an honorarium you might offer a faculty or subject matter experts. Are they going to be on 1 time, or are they going to be on 15 times, right? So you can see how this is almost like a domino effect. Another question I often ask Allison is, okay, is there an average number of people that come and tune into the ECHO, like a spoke participant? And again, that number has ranged for ACS from 20 to 60, and theoretically you could have 100 people on, but the point of the Project ECHO is to keep the model intact, which is case presentations, community feel, feedback from faculty, and you can imagine the bigger you get, the harder that is to maintain. So that just gives you an idea. And then also for the number of faculty, it probably will depend on your topic area. So here at ACS, that's ranged from 2 up to 8 or more. At times, that number of 8 has included what they call ad hoc faculty. So maybe not somebody that's there throughout the entire 9 sessions, but has a certain expertise that really is most applicable during one session. Any comments to this, Allison, as you're looking at
Yeah,
it?
yeah. I mean, these numbers are variable. Like we say this 9 sessions, 60, 20 number of faculty. If you look on our website, which we'll provide later, you'll see we have all our faculty listed. Some larger series, which this is not going to be like a large series. We have 40 faculty, state-based, national-based, but really like you want to have it's weird to say smaller the better. I think you want it to be as intimate as possible, but still having enough representation from the areas that you're working with, and enough representation from expert faculty and ad hoc faculty that you really can have a robust conversation and create an amazing sense of community.
Yeah, thanks. Okay, next slide. So I also saw this question in the chat, so we anticipated that, which is great. Maybe you're out there and you're thinking, we are a cancer coalition. We would love to do Project ECHO. We're planning on doing an ECHO, but we don't want to be the hub. If we get someone to be the hub for us, what are some things we could do to help support them? Like, what's the difference? Well, as Allison mentioned, really the biggest difference from what I can tell between a hub and somebody who's supporting a hub is the amount of personnel time that it's going to take to do something. The buck stops with the hub, right? They are the ones that you are charging with getting the speakers and securing the final product for your ECHO series. But there are a lot of ways that you could help make their lives a lot easier and even make it more applicable for your coalition. You could help them find subject matter experts. You guys know who your community is, you know who your partners are. There's people that have been coming to your coalition for years that would really probably be honored to be a part of a faculty for an ECHO series. So you can help them identify faculty, and that faculty could even have input on the curriculum. Or perhaps you've already kind of been doing something with your coalition and you said, we know that our curriculum is going to have to address these 4 things. So please make sure that these are 4 of the sessions that we do. So really informing the content for the curriculum that you use for the series. We've also seen coalitions really get the word out. We're good at that, right? We know how to make promotional materials, get those into a lot of different organization hands, and do some promotion. So you can definitely help with that. Recruiting people to show up. I mean, that's a big deal, to get bodies in the door and folks that are willing to commit to the series takes relationships. And that's what coalitions are based on, right? Are those relationships. So you can help connect people to become spokes. If you have the resources, you can provide funding for the hub to actually conduct the series, right? Because as Allison said, it does take quite a bit of time for personnel. So if that's something that your staff doesn't have the capacity to do, you could use something like the supplemental grant or some other funds that you come across to enable a hub to do what they do. And I would say the other thing that I can see a CCC coalition really doing is just offering a platform to then share what came out of the ECHO. So maybe not everybody from your coalition is a part of the ECHO itself, but you could most certainly at your quarterly meeting say, we just finished this ECHO, here's the evaluation we got from it, here are the lessons learned, and it can just keep informing the work that you do. Anything, Allison, that you want to add on funding support or any?
No, I think you covered it greatly for them.
Next slide. So before we hand it over to our panel, we want to just spend a second. I put myself back in my program director days as a coalition program director and said, how would I have decided if an ECHO series would be right for our coalition at this? And I found this quote and I love it. The ECHO model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. So it really becomes a question of, how do I know if this is the right time, right? Do I have the right people at the table? Is our coalition the right venue to host something like this or to enable something like this to happen? And is it at a good time in the process of where our coalition is in general? So I would challenge you to think about what your coalition's priority cancer plan objectives are. Many of you have either recently updated or are currently updating your cancer plans, and you often need to pick, 1, 2, or 3 priority objectives that you're going to focus on, because we can't implement the whole plan, right? Well, are there some priority cancer plan objectives that you could develop an ECHO around that that would help get you from A to B? Is there an echo series that would help you achieve one of those objectives in your cancer plan? That would be my word to you. Next slide. The other thing I would say is think about if your coalition already has a relationship with an echo hub in your state or tribe or territory, and we're going to provide a link for you in chat where you can search to see if there is a hub. Many of you have probably already done this if you are applying for supplemental funds, but even just for down the road, as you think about whether it's possible, do you already have a hub nearby? And then if you don't, or even if you do, is there any barrier to you thinking about becoming a hub yourself? That's something to think about. We'll talk a little bit more about that in a minute, but as you look at that hub, is there anything you can do to build a relationship with that organization and utilize them for this purpose? Another thing that I would want to consider is, are you going to be tailoring something that exists already as a curriculum, or are you going to be creating something from scratch? That's a big, creating a curriculum is a pretty heavy lift. And, that would be expedited, of course, if you have something that you already can work from. So that's something I would take into account as I'm thinking about staff capacity and coalition capacity. And then do you feel like your coalition has access to experts for this priority topic you're talking about? Or is there going to be a lot of ground to cover to make those connections, to identify people and to recruit people? That might let you know if this is the right time or if it's something you need to work towards if those relationships don't already exist. And then, do you have a staff person in your coalition who could lend some level of support, right, to planning and conducting this? So if you're not a hub, which most of us probably aren't on the call, do you have somebody that could be like the point person for a certain percentage of their time to not be the one who's planning everything, but who at least is able to lend some level of support to a hub and helping them identify and recruit and tailor it to what you need? Next slide. So Allison, you have some crackerjack teammates that you've worked with to lead various echoes that I know you've invited today. Would you go ahead and introduce them and talk a little bit about what ACS's echo situation is right now?
Sure. Okay, next slide. To give you a little bit of a recap or a little bit of summary of what ACS has done, we've been a hub since 2018. We have, I think, currently 38 series, but completed over 30 on different topics related to lung cancer, patient support, lung cancer biomarker, health equity in colorectal cancer, health equity in general, LGBTQ+ in cancer care, reducing disparities, hospital system capacity building. So I could go on and on, but we'll add our website, which is echo.cancer.org, into the chat so you can sort of look and peruse what we've done. And we've done everything, again, from implementation to more clinic-based to hospital system capacity building. So really, Echo lends itself really well to all different topics. And we've worked in English and Spanish and with other countries as well. So please visit the website to sort of get a better understanding of different programs we've done. If you want to get a better attend virtually one of our Echo series, because they're all on there, all the videos. Next slide, please. So now I don't do it alone. We have a whole slew of amazing people at ACS that are coordinators, that are part of hubs, that do so much for the echo space and have made it successful. And so we have two people that have successfully run echoes and been a part of echoes that are going to give a little bit of information on what their program was and some lessons that they learned. So we have Amy Ellis and Trelisa Hall. So Amy, do you want to start us out?
Sure, happy to go first. Yes, I'm Amy Ellis, and I am here in Mississippi, and I have the pleasure to work on a lung biomarker echo that took place back in 2021, and we were able to recruit about 11 hospitals across the state. That was, most of the work on the front end was recruiting the hospitals and getting them engaged in this biomarker echo, and we had amazing leaders, so that certainly helped within some of the hospital systems that were helping lead our ECHO, but we definitely worked hard to recruit those hospitals and get them engaged and get them on board with the process. And probably one of the most, and it went amazing. And we had about 90 participants, or 90 people register for that particular ECHO. And lots of new relationships were formed through the ECHO of some hospitals that we might not have been engaged with, that deeply before. But also probably the most exciting thing is that as a result, or at the end of our ECHO, it ended January of 2022. And that was kind of our last ECHO, but our transition into forming the Mississippi Lung Cancer Roundtable. So definitely an exciting transition for us, and kind of what we had hoped would happen. And certainly after the excitement through the ECHO and the involvement that we got from the different partners, we felt pretty good about moving forward with that. So that was one of the most exciting things that's come forth.
Awesome.
So,
Thanks,
Awesome.
Amy.
sure.
That's great. And I think the fact that after the ECHO, this roundtable was formed shows the power of the ECHO model and the relationships that are built as a result. Thank you. And Trelisa, do you want to share about your ECHO experience and sessions and series?
Yeah. Good afternoon, everyone. My name is Trelisa Hall. I'm a program manager under the HPV Cancer Free Texas campaign. My role is ECHO, so it's a bit different from what you may hear or see with others who are working with ECHO, but I am hired to do ECHO. With that said, I've done 2 clinics thus far with 16 cohorts of HPV vaccination-related ECHOs. There's so much that we've talked about throughout this session that's so important for everyone to know. We've had really, really great impact on our community. My #1 ECHO is focused on CHWs. We know the impact that CHWs can have in our communities and the influence that they have in communities in making change when it comes to public health. And so we've been able to touch over 1,000 CHWs here in the state of Texas. We are able to show through evaluation the impact of the ECHO that we've been able, the information that they're receiving, the value of it, how they're taking it into the communities. I'd say for me, one challenge would be retention. I have this ECHO as an 8-session ECHO that meets bi-weekly. I go from a registration of upwards of 500 CHWs to a consistent attendance of 50 to 70, which is still a high number, right? So it's still a good thing, but I focus a lot on retention and making sure that the CHWs are coming back. I think it's really important to engage with our coalitions. I also lead our Texas HPV Coalition. And so for my hub members, for my ECHOs, I pull from subject matter experts that are part of my coalition. It's really helpful. They serve as hub members. They have served as didactic speakers for sessions. And it's really been influential across the organization, because I'll see providers that have spoken on my ECHO speak at another ECHO somewhere else across the country, just because they were noticed on, the HPV vaccination ECHO that we hosted here in Texas. So there's a lot that we can do with our coalitions, with our local coalitions. You guys can play a really great role in the success of an ECHO, because there's so much valuable information that is within a coalition. So there's just a great deal of impact that the ECHO has. I could go on and on, but one thing that I will say is the networking that happens within a coalition is really important and really influential and impactful. My CHWs, absolutely, after 8 sessions, of course, of talking about HPV, it can get kind of personal. And so you really build a relationship with those people who you are seeing on a regular basis, who we're, discussing cancer with regularly, and so the networking that happens there between organizations is really impactful. And I'm excited to say that when we wrap a cohort, many of my CHWs are just like, okay, what's next? You know, they want to stay around. They want to continue to work with us. So much so that we've developed a CHW alumni group to keep them engaged with ACS and what we're doing. So there's so many opportunities that come out of having an ECHO and really connecting those persons together from all the different parts of our state and our country and what we're doing here in this space. The importance of having a curriculum already developed is awesome as well. So if you can pull from something that's already been created, it's ideal. I would say development of a curriculum, it takes some time. It takes some time, it takes some funds. And so you want to make sure that that's something you can do. But I'm excited to answer any questions that you guys have. If you want to reach out to me outside of here, I'm also available. But if you're looking at doing an ECHO, it's a great opportunity.
Thanks.
Awesome. Thank you. And I know as a part of this call, we also have other ACS staff that have helped lead and been a part of ECHO. So I see someone made a comment, and any ACS staff that have been a part of ECHO help plan, feel free to chime in and share what they learned or different things as far as why the ECHO model worked for whatever they were doing.
I have a question, and Rich, I don't know if you can unmute people for the webinar if you see somebody with a question, but feel free to do that. But I'll kick it off. Terlisa, looking behind the curtain as someone who's planned a lot of ECHOs, where do you find you spent the most time in the pre-planning phase?
Curriculum development.
Curriculum, okay.
Curriculum development. We had to go through so many steps. You know, in Texas, CHWs are certified, and there's a process. So we start with working with ourselves, you know, within the organization and trying to develop a curriculum. But then I had to work with Texas A&M to be a host. And then I had to work with the Department of State Health Services to get it accredited. And so it was a very long process that we had to schedule out in our time of developing this ECHO. So absolutely, curriculum development was what took the longest amount of time in the planning process.
Okay, thanks. Amy, would you chime in on that too?
Sure. For us, it wasn't necessarily the curriculum development, it was more the recruitment. I think the curriculum was developed pretty much. We had a grant to do this, but it was really the recruitment. So that took kind of explaining, you know, what is an ECHO, you know, what are they getting involved in, that sort of thing. So it kind of took us really explaining that and trying to help them understand what they were getting involved in and the impact and the importance of why we needed them involved. So for recruitment, I would say, yeah, more recruitment.
Okay, awesome.
I'm
go ahead,
looking,
Allison.
yeah, well, so I'm looking at the time and I'm looking at the amount of questions, and I know we have some hands raised too. So I'm looking, I think we answered about, you know, budget for Project ECHO already. I'm looking at what else, what baseline costs. I mean, I think I said that again, ECHO can be free and just be the amount of time that staff do, or you can give stipends for faculty or some of the participants. You can look at, in the chat, Rich provided on the University of New Mexico's website, there's a dashboard. You can look to see any hub to see if there's one in your state that you might want to potentially partner with. Let's see. So that was answered. Does a survivorship curriculum already exist? So Katie, maybe you want to answer this based on the research article that came out.
Yeah, for those of you that are on from Comprehensive Cancer Control, I know that Elizabeth Rohan, who works with CDC, was one of the principal authors on a journal article that really kind of was the basis of this whole opportunity for this supplemental opportunity for you all. And so I would encourage you to reach out to your CDC program consultant to see if there is a curriculum that's associated with that's existing. I know that there were 4 states that were funded that were involved in that article. And oh, Elizabeth's on the call. Well, isn't that handy? Can you unmute Elizabeth if you want to address that? Let's see if we can get straight from Dr. Rohan. Go ahead.
Hi, everyone. So the question was, if I'm understanding it, like, was there a particular curriculum, right? That
I think people are wondering, could they repurpose something?
I'm sure they could. So each of the states, and maybe some are on the phone. So we there were Montana, South Carolina, Kansas, and Nevada. And so they had done some preliminary investigation into their the needs of rural providers in their states, and they had a focus on a particular rural area. So they kind of did a, I wouldn't say a survey, but they talked to some providers to find out what were the needs and based their curriculum on each of their curricula, I guess I should say, on the needs that they were trying
Okay.
to address.
So it was
So
really tailored to their state. Yeah.
but actually we're having a PD call next week, and I
Okay.
can certainly share what those four were. I have them each on a slide, just like sort of like generally like just topics.
Yeah, that's
yeah.
great. Thanks, Elizabeth. Thank you so
Yeah,
much. Sorry
for
to put
sure.
you on the spot like that. I'm
That's
glad
okay.
I'm so glad you're on. Yeah, so tune into that program director call next week and hear more from Elizabeth about those 4 states if you're with a comprehensive cancer control coalition. I'm going to, would you mind pulling up the next slide? And as I'm talking for this next slide, I also would love for you to pull up the poll, Rich, if you don't mind. We have a closing poll, so stick with us and let me give you some nuggets. As you're filling out those questions, there's probably, I don't know, I think 6 questions. Scroll down so that you answer all of the questions in the poll. But you're thinking to yourself, what next? How am I, what could be my next move? We suggest, as we've said, look to see if there's a hub in your state and contact them. Some of you have asked about costs. We don't pretend to know. We're just one hub of literally probably hundreds and hundreds of hubs that are out there. So what it might cost to run a hub would really vary so differently. So contact a hub that's near you if you're interested in learning more about what it would cost to work with that organization. Like we said, it probably is primarily staff time that you would be helping pay for. And then maybe talk to your coalition about what would it look like. I had that list, and I'll send you the slides of how a coalition could partner with a hub to conduct an echo. Go back and talk to somebody in your coalition, your chairs or work groups that you think, this could be a good fit for them. Maybe not this opportunity on survivorship and patient navigation, but maybe something that you're looking to get more involved in and you want to get some momentum around. And then I would challenge you to think about what would be the pros and cons of you yourself, your organization, your coalition becoming a hub. If you feel like if you look at your work plan for your coalition and think, man, we just do so much provider education. We do so much work with patient navigators, community health workers. We're constantly educating. Then you might want to really think about it. Is this something we want to pursue as a sustainable model? Would being a Project ECHO hub ourselves be something that we're interested in looking at? And I know that that's a big decision, but I'm just planting a seed. The American Cancer Society, Allison and her staff are working to become what's called a super hub, which would mean that ACS, as a national cancer control organization, would be empowered by the University of New Mexico to actually train hub organizations. That's going to be a process over the next year, so stay tuned for that. Keep us in mind and we'll be in touch with you. If you should desire hub status sometime down the road in the next 5 years or so, think about checking back and see who could train you to become a hub. So we also have on the next slide a link to our email addresses. So please feel free to reach out to Allison or myself. We can get you in touch with Amy or Teresa or a myriad of other ACS staff who've worked on Project ECHO. And I think just in closing, I want to say thank you for your time. We know it's Friday morning, Friday afternoon, wherever you're calling in from. We appreciate you setting aside this hour to be with us. And we hope you found it informative. And we'll look through the questions in the Q&A. And if we weren't able to address them on the phone, we'll be sure to be in touch with you via email. So thank you all so much. And we'll give 5 minutes back to your day. Thank you so much. Have a great day, everybody.
Thank you. And if you haven't filled out the poll, please do so before you leave.
Yes, we'll stay here for a few minutes to leave it open. No rush.